welcome to the Voyage Clinics Podcast. I'm your host, Dr. John Sanders, family physician. And today I'm with one of my favorite people, Melissa Holmes. She is a mother and a friend, and she's just great. And today's podcast is really about questions that mamas often have of their doctor. So we just wanted to kind of focus on that. And there's a lot of really great questions out there, and I don't always know those questions because I don't often ask those questions. I answer them. So I thought this would be a really fun podcast. Melissa, why don't you just kind of introduce yourself and tell us about your journey?
Yeah. So I am a 38-year-old mom of 3 daughters. My daughters are, 14, 12, and 9. I grew up in Utah, born and raised. I've lived kind of all over. I got my bachelor's in international studies. I took some time off of my career to raise my babies, so I was really in the thick of it there. And the last 2 years, I've gone back to work, and I do international humanitarian service. I'm the director for an organization called Humanitarian. So I'm doing the balance thing between work life, mom life, and kind of trying to work that out. And I love being a mom. I love my job, and my favorite things to do are like read. I'm kind of boring sometimes, Dr. John. I love to read. I love to research. I love my novels. And then I also love being with my people, my friends, my family.
Yeah.
So
I love humanitarian work. We did a medical mission trip to Kenya a few years ago as part of Voyage Clinics. I took one of my sons. That was super fun. Tell us a little bit about Rome and about your international things. That's super cool. I think it's a beautiful organization. Sean and I have attended a few of your guys' events.
Yes, you have. I'm so grateful for that. So Rome Humanitarian does international humanitarian service. We're in 8 countries right now. We focus on sustainable service. Right now, our main focuses are women and children, single mothers. There's a lot of abuse going on in a lot of other countries that is very normalized and legal. Things like FGM, female genital mutilation in Africa, a lot of that is going on. A lot of trafficking. So we work with a lot of that. We've got a women's center in Nepal. We're currently building a women's center in Tanzania. And we also do a lot with water, sustainable water wells, filters, teaching people about clean water, because a lot of that healthful living stems from that. So
how has this been a good balance for you? Like getting kind of not only back into the workforce per se, but like, you know, a lot of moms in their mom journey, they kind of lose themselves, right? They lose their body to a baby. They lose their, breastfeeding and up all night. And so there's a lot of sacrifice on this motherhood journey, as you know. How has that been for you, just getting back into kind of things that you love as far as vocation, but then also such a cool women's organization that empowers these women to just find themselves and discover beauty in their journey?
Yeah, well, I'm not going to pretend that it wasn't a rocky road.
Yeah.
So being a mom is so beautiful and wonderful, and I really was grateful and enjoyed my time as a stay-at-home mom. I got to the point my kids were getting more into, school age, and I had a little more, I was finding maybe I had a little more time on my hand, but more I just had a little more time to think. And I started wondering if it would be fulfilling to go back to work. But I will say I tried my hand in I dabbled in a few different things and just didn't feel, I just wasn't happy.
Yeah, it wasn't the right fit.
Sure. And so as I was kind of dabbling in these things, I was like, oh, I just don't know. I am feeling lost. Mm-hmm. I am feeling like, is being a mom all that I have? Not that that's not enough, but what about when these kids are, up and out, and then is that all I have? Am I going to be texting my grown children all day, every day? So I'm not saying that it's right for everyone, but for me, I really felt this pull towards finding something that was fulfilling for me. Now, I am very, very lucky to have found an organization at the right time when they needed it and I needed it. And it was a really nice fit that is both fulfilling and furthers my career and, enhances my life in so many ways. It's also nice because I do work from home, so I still have some flexibility. So as a mom, that's been really a blessing. And I also think just something that was lucky, but it's taken probably 5 years of really intense, like finding myself. It's been reading books, going to therapy, trying a bunch of different things, discussions with friends, with professionals. And I did feel kind of lost for a few years. Mm-hmm. And I don't know that that's atypical.
I think it's super common. I think it is super, super common. The hero's journey of most mothers is one of losing self. They often do. It gets gray. It gets fuzzy. Where do I end and where do I begin? Where am I like in this mix? And it's actually beautiful. It's a galvanizing process of, it's incredible. But it's also difficult to come through that. And I do think the therapy piece and the life coaches and maybe the mentors and the people along that path can be so helpful, so helpful to just rediscovering, well, who am I and what do I like to do? Like, do I have hobbies and interests, or is it just, nursing and putting out fires and, and for a time it is just that. And there's nothing wrong with that. I think it's the most beautiful profession in the world. Like, it is beautiful. It is 2.5, 3 jobs in one, and the sacrifices and the energy and the effort and the focus and it's a lot. It's a lot. One of the things that I often advise my mamas to do is, even with a newborn, even with a very new baby, I say, make sure that you're team parenting and that you're taking me time, 2 hours or more a day. Just take some time. And even if you just sit there and be bored, that's fine. Take a walk, go breathe, read a novel, go to a movie, do something you enjoy, go to the gym, do something you enjoy and maintain that sense of, this is what I like, right? This is what I enjoy. My wife, Shauna, she underwent a similar process. I think it's super common. I think it is super common. And it's been really beautiful to watch as our kids are leaving the house and she's, in the latter parts of that journey of raising these kids. And she has engaged in beautiful ways. And she just keeps blossoming and blooming, similar to what you're doing. Like, you're just, it's wonderful. It's super cool. And it speaks to the resilience, I think, of mothers. They're so resilient.
Absolutely. And it's one of those things where I think you're right. You can't really get out of motherhood without at least some of these feelings. But like you said, the self-care is so important. That being said, it's hard to find, when you have kids, it's hard to find 2 hours a day. Yeah. So I would even say, like, if you can get a 30-minute walk in and clear your head, or this is a perfect time for like a TV show.
Yeah.
My kids are going to watch a TV show, for 30 minutes, an hour, and I'm going to take a minute, because not everyone has the resources for, a babysitter, or maybe, when my kids were really young, my husband was working 2.5 jobs. Yeah. And so he wasn't, there. It's time to call on mom and sister and, all the people, all of your, kind of tribe that you can around you to be helpful. And sometimes I think even with my daughter who's getting into her teen years, I'm seeing this belief in her that she's the only one that feels a certain way. She'll be like, well, I'm so different because I'm feeling this way, or, and no one understands me. And I've seen that even those thoughts creeping into my head as a mom too. Well, no one gets this. Like, I'm busy, or I've got this and I don't have time for self-care or for this. And I have to remember, like, we're all human. Everyone, or at least a lot of people, are feeling similar feelings that I'm feeling. And so reaching out, and then once you reach out and you're vulnerable with, say, another mom or your own mother calling and be like, Mom, I'm kind of need a little help here, or whatever it is. That vulnerability really opens up a really cool connection. And I'm trying to teach my teenage daughter that at this point. But just getting through it, and not only getting through it, but trying to enjoy the whole process, because discovering, like you said with Sean, every step of the way is a new discovery.
Mm-hmm.
And I got to a point where I was like, oh, I didn't realize I even needed to, grow in this way or change in this way, or that there was this piece of me that I didn't know I even had inside of me. And now that I've worked on this, it's come out. And it's been really a cool thing. Now that I feel like I'm over one of the biggest humps of that specific part of my journey, then I feel like, oh, wow, that was learning experience and that was hard.
Yeah.
But
that's so cool. Thank you so much for sharing your journey. Those pieces of you that you discover, those new pieces, those are it's just so enriching, as you continue your journey. I will make a call to papas. I think, culturally, sometimes we're raised in homes. I know I was. Like, I grew up in a mining town, right? And Dad was working 10 to 12-hour shifts in the mine. And he'd come home and he's wiped out, and, he'd crack open a beer and just kind of chill the evening. He'd watch some wrestling, because we're like wrestling, like, the typical mining town stuff. And there wasn't much involvement, right? And so I think we're given kind of sometimes a model of being papas that might not be awesome. And so I would call to papas to do better, to say, look, mama doesn't get a break. She's been working longer than you have. Her work shift started at 2 a.m. nursing this baby. And yeah, you went and you worked a job or a job and a half or 2.5 jobs, but mama doesn't get a break. And so let's be better papas, and let's get involved in that parenting process. One of the things is, like, even just in the nursing babies, like, take a shift, right? Nurse, pump, get some breast milk storage, and then Dad is going to take the 4 a.m. shift, right? And then mom can get a good 6-hour chunk of sleep. Like, that's a simple thing. And then as the kids age, like, get home from work, and your first objective is not to kick your legs up and crack a beer. It's to, honey, what can I do for you, right? How can I help you? You know what, babe, take a break. Mamas are programmed for self-deprecation. They're programmed to put everyone else's needs above their own. And it's to a fault, honestly. And so mamas have a little bit of better boundary, communicate that vulnerability. Hey, I'm actually quite wiped out right now and I need some me time. That's a vulnerable thing to say to a husband. And husband's like, well, what the hell? I've been working all day. And the answer is tough. I need me time. And husbands do better at that. Like, hey, what can I do for you? That's a better approach. But I think that is a helpful balance as we go forward, like finding a space to allow papas to do better at giving mamas some me time to discover those parts. They're only more beautiful to you, right? As my wife has undergone this same journey, and I'm like, wow, like, I didn't know you had that in you. That's super neat that you've discovered that, and that's beautiful, And so it allows mamas to self-care, and they're more beautiful, awesome, and better. And so it's only helping them, help you, and it's great.
Yeah, I love that. And it is kind of vulnerable for a mom to be like, hey, this has been hard. I know that the house is still a mess and I've been home all day, but I literally have been
putting out fires.
Wiped out.
Yeah.
I'm wiped out. But I think also on mama's part is, hey, I know you've been at work all day too. Mm-hmm. We're both wiped out. Yeah. And even to the point of maybe we need to get a sitter and the two of us need to go and just sit at dinner and eat dinner, whether we're quiet or we're talking or we're, getting a minute away. But finding that balance and really, really communicating your needs with each other, that's been a really big thing with my husband and I, have been like validating each other of like, yeah, you've been at work too. So I know you've been using your brain. You've had to be, on with your coworkers and your, everything you're doing. And I've had to be on with kids where you don't get a coffee break or a bathroom break. Yeah. And so understanding that you're both tired and what you can do to help the other person is so important. And it's really improved not only like my personal life, my marriage, the family life in general. So
Totally.
I think that's such an important aspect that I would love to really instill in, thinking forward, and my daughter's getting married, really, you can only tell your kids so much. They don't listen that well, but really trying to encourage that with them and their husbands and their children, because I think if you can skip or at least lessen the amount of time that you're kind of trying to work through that battle, if you can do that more up front, then I think it's beneficial to the whole family.
That is so good. I just texted my wife because I want her to send me a poem that she just wrote about this journey. It is so good. Like, she has many talents, but poetry is next level. She's just really, really good. So I'm going to see if she's willing to share it. She just wrote it not long ago. But it is about this very journey. And if I can't get it now, I'll read it at the end.
Cool.
Thank you so much. This is so cool. I like to start all our podcasts with this journey and listening to kind of your story. And I think it applies to so many mamas out there. So there's some pearls of wisdom that we kind of both popped in there. So that's really fun. Now let's shift gears to like questions. So are there spaces that you kind of want to shoot towards me questions, and let's just go from there.
Yeah. If we're shifting into like moms with questions for doctors, I've got a lot of questions for you. Okay. So, starting from, little kids all the way up to teenagers and in between, a lot of things come up on a daily basis for moms that's like, I don't know, do I need to run to the emergency room and pay $1 million fee? That was an exaggeration, obviously. Do I need to get to urgent care? Do I need to call my doctor and get in as soon as possible? And so a few of these that have popped up multiple times throughout my experience in motherhood is rashes. Rashes. I'm like, this just popped up. Is it a heat rash? Is she allergic? Do I need to pop a Benadryl in? Do I need to find an EpiPen?
Yeah.
That kind of thing. So rashes is a huge one. So what would you say about a mom who's looking at her kid, this random rash pops up? Where do we go from here?
Okay. I love it. There are so many rashes on kids, and starting from newborns to, adolescent to all of it, pediatric, everything in between. So newborn rashes, they're very, very common. As a newborn comes out into the world and starts, getting exposure to things, there's a very common rash that looks really bad, but it's not, and it has a bad name actually, but it's called erythema toxicum, and it can be these little pimply things or a little rash, and it could be all over their whole body, and it is super normal. I would just bring that, a lot of my rash discussions with mamas is reassurance. Now, this is another normal baby rash. There's cradle cap, right? And cradle cap can actually start to spread to their forehead and their eyebrows and even onto their face a little bit. Super common in newborns and babies. There's rashes around the mouth. We see so much of this since the COVID time where they were wearing masks all the time, keeping a nice little hot, humid, incubated space for bacteria and fungus to grow. So that'll cause like perioral dermatitis. I'd say bring that one to your doctor's attention. It's not emergent or urgent, but it is something that we should address because it's not going to go away. There's rashes on the face like angular cheilitis, the little cracked corner of the lip of the mouth. Super common. It's often from either a B vitamin deficiency or more commonly is yeast. And so you can get like a little yeast thing here. You can get kind of a yeast infection around your nose. You can obviously, acne is considered a rash, and those would be easy things that we can address. The rashes that they're time-sensitive rashes, right? So there's a few of them that are time-sensitive. I would say anything that has little blisters in it, bring that to your doctor's attention right away. Blisters can signify one of the herpes viruses. There's like herpes zoster, which is like shingles. And then there's actually herpes simplex, which is like cold sores, but you can get them on your hands or on your body, especially nail biters and stuff. And they're called like herpetic lesion of Whitlow. And then you can get herpes gladiatorum. So wrestlers can get like herpes on their body because they're just wrestling all over and they got a face and somebody's got a herpes. So I would say anything with blisters in it, bring to your doctor's attention. Anything that causes little bruises everywhere, like on the legs, starting on the legs, bruising, kind of spreading up. I just had a kiddo with this like last week, actually. It's called Henoch-Schönlein purpura, HSP. And they just look like little, they're not bruises, we call them petechiae, but they're like little red blanches they're like little spots that are just capillaries that are bursting. And that's a big deal. There's post-viral xanthums, so these viral rashes that are out there, tons of those. And so I just got sick. I got a runny nose, cough, fever, and 3 or 4 or 5 days later, now I have a rash. Those are often benign, nothing to do for that. If your kiddo has strep and then gets a rash, that's a big deal, right? Like scarlet fever and things like that. So strep is, if it goes untreated, can wreak havoc on a kiddo. It can cause post-streptococcal arthritis, which is like strep can invade all of their joints, which is horrible. It can cause heart valve issues. It can cause kidney issues. So strep is a bad bug. So strep rash is a big deal. Your question about strep, let's go.
Oh yeah, sorry. I'm just wondering now that I'm thoroughly scared about strep. How do I kind of differentiate between like my kid's sick, got a fever, a sore throat? When do I take them in for strep?
Yeah, this is hard. And even doctors can get fooled sometimes on this. And let me explain why. So strep has a central criteria for diagnosing strep. And the central criteria talks about like, do they have a fever? Check. Do they have swollen lymph nodes? Check. Do they have like a beefy red throat? Check. And then do they have a cough? So no cough, and they have all those other things. No runny nose, no cough, because that's virus. Runny nose and cough is all here, coughing, and there's sore throats coming from the mucus and all that. Let me give you a caveat though, because cold and flu season, kids will have a runny nose, cold virus, no big deal, and it was 3 weeks ago. But then they can have this persistent runny nose and a cough for 2 months afterwards. Let's just pretend 2 weeks ago they had that. They're still boogering and coughing. And you call me and say, hey, my kid has a fever, a beefy red throat, swollen tonsils. I think they have strep. My question is, do they have a cough and they have runny nose? Well, they do. Your answer should be, but they've had this for a while because they had a cold. And because that can confound the clinical picture. In those cases, I just swab them. I'm like, let's just rule out strep to make triple sure. Strep has a very classic presentation clinically. So healthcare providers are trained to like recognize strep. And so it can be really tough to tease out, but that's the typical central criteria for strep is like no runny nose, no cough. But during cold and flu season, I'm going to throw that out and I'm going to say, my disposition for just checking these kids and swabbing them is much, much lower. Does that make sense?
Okay, yeah, that's super helpful. I love that. And then in that case, is it something where I go to urgent care or do I just call my doctor and set up the next appointment?
What do you do at Voyage?
Well, this is why I love Voyage Direct Primary Care so much, because I send Dr. John a text. Hey, these are the symptoms. This is what's going on. Do I need to get into you quick? What's the best route? And that's really why everyone should be with Voyage Direct Primary Care, but Direct Primary Care in general, because here's my options. I can either run to the emergency room and feel kind of like an idiot, maybe. If urgent care is open, I can't go to urgent care and maybe wait in a waiting room full of people coughing up who knows what all over and wait for who knows how long. And then I don't know if you've heard the horror stories about some urgent cares, but I sure have as a mom. Like, oh, they didn't catch this and now we're in this situation. Yeah. Or I can call my doctor's office when they open first thing in the morning, because we all know, at least all moms know, sickness is worse at night when all the offices are closed. So I can wait and call my doctor in the morning and be like, well, they're feeling a little better. What do I do? When's your next available appointment? Okay, next week. All right, well, we'll take it. So those are my options as a mom.
Yeah.
If I'm with direct primary care, I pick up my phone at any hour, any day, and I send a text, to my doctor, Dr. John, and say, these are the symptoms. What do I need to do?
Yeah.
And I get a text back that says, here's my follow-up questions. Let me give you a call. Let's meet in the office. We're fine to wait till the morning. And I feel so seen and taken care of as a parent that I'm doing what I need for my child and not wondering and worrying. Could I have? Should I have? All of these questions that literally moms it's just always here.
No, it's
always
scary.
here.
No,
and
yeah.
I don't know if dads get it. I don't know if you get it.
Yeah.
Maybe as a doctor you do, but like moms have this in the back of their head all of the time with their kids.
That's so cool. That is exactly why I started Voyage Clinics. I saw these broken pieces of the healthcare system. And in fact, the straw that broke this camel's back was a case that I had when I first moved here from Moab. I was a country doc in Moab for 6 years, delivering babies, working in the ER, doing hospital, hospice, busy clinic, pediatrics, everything. And we moved here, and I was working for one of the corporate conglomerates, the local big corporate medical groups here. And I quit after 2 months. And this was the story that made me quit. So I saw a kid, and this kid was 8 years old. And mom says, I don't know what's wrong with my kid. Something's wrong with him. So she brings him in, and I look at this kid, and he's swollen everywhere. Every joint, every finger, his wrist, his knees, his elbows, his sacrum had a big old effusion on it. And I said, wow, I've never seen this. This is third world country stuff. I've never seen this. Tell me what's going on. She says, well, I think this is strep. And I said, oh no, please no. And she says, no, I think it is. And I said, well, tell me a story. So she says, I had a kid and my kid got sick. We took him to urgent care, and the urgent care person said, this is just a virus, and sent him home. So I was a little frustrated. They made me feel stupid, and I didn't know the person there. And so my other kid got sick, this one, fever, sore throat, similar symptoms, right? Similar symptoms. And so I didn't want to feel like a dummy. I didn't want to wait in this really busy, really boogery urgent care waiting room. So I didn't go in. And then my other daughter got sick, and she was quite sick. So we took her in. They swabbed her for strep, and she came strep positive. He never got treated. She got treated. They wouldn't just call a script in for my other kid. They wanted me to, so it's a mess. And people would blame this mother for this. I was like, this is not this mother's fault. This is a broken system's fault. And I'm done. I was on the phone for an hour and a half with cardiology, because we have to check for those vegetations on the heart valve for this kid. Pediatric orthopedics. I said, we got a kid with post-streptococcal arthritis now. How do we manage that? Do we need to put him on IV antibiotics? Like, he ended up at Primary Children's for a long time, and it was a hot mess. And this is so simple. Like, the treatment for this, like the swab, is like $1, $2, and the treatment, the oral antibiotics. This is cash price for these things. The oral antibiotics for this are about $5. And so for $7, this kid could have been diagnosed and treated. And again, like, teasing out what is strep, what's not strep, that's not your job. That's not a mama's job. That's a doc's job. And knowing these kids and the nuance, right? Yeah, this kid had a cold, but tell me more, right? Let me ask a few more questions. I would hop on a phone call and just say, tell me more. What's going? No runny nose, no cough. Or yes, runny nose, yes, cough. But he was sick a few weeks ago. So I don't know. He's kind of been boogery this whole time. I would have said, well, come in. Let's just swab him to be safe. And so I think that was for me the big catastrophic situation. And that's why I've started Voyage Clinics, because I said, I don't want this to ever happen again. This is third world country. This happens a lot in third world countries. In fact, I managed a gal from the Philippines in Moab who had moved there from the Philippines. She was, and she had heart failure from strep because of the valve issues that were caused from that strep infection that went untreated. So don't mean to get too doom and gloom, but that's a big deal. And that I think your story really delineates the upside and the broken pieces that are fixed at Voyage Clinics and many other direct primary care clinics around the the United States.
Yeah, and I love that. And ever since I joined Voyage, which I'm trying to think, Dr. John, how long has it been? Maybe 4 years or so. And I was looking for a change. My husband was working at the time. I wasn't working. The insurance prices at his work that were offered were astronomical. And I felt stupid when just like you were saying, like, why am I overreacting? Am I underreacting? I don't know where I fall on this. Plus, I've got these astronomical prices and I don't feel like I'm getting any care. I'm scared to use it. I remember my grandma, she had like her private insurance, her Medicare, and, all these things, but she wouldn't go to the doctor. And that came up in my mind and I was like, there's got to be something different. Mm-hmm. There has to be someone who's trying to change this because this is not right. And this is not helpful. How is this even helpful to me? So after digging and researching, and it was my sister who mentioned you, and I was like, I'm just going to look into it. Looked into it. This has been the best switch. I will never, ever go back to traditional insurance. We have, personally, we have a health share that we tag on to our Voyage Direct Primary Care membership. And because we have these kind of really beautifully married options, we've had zero need for a traditional health insurance. And I don't know, I wish I could go back. You have my chart. You could go back and see how many times I've called without reservation. I don't feel bad calling and saying, I don't know. Do I worry about this? Do I not? My daughter, I have an experience. My daughter was unloading the dishwasher and dropped a knife on her foot when she was putting it away. And I was like, well, crap. Do I take her to, what do I do? Is this like stitches? But I immediately, I didn't never even think crap. I just was calm because all I did was, okay, let's take a picture. Breathe. Let's, make sure you're comfortable and okay, sit down so we don't pass out. And I send a text. Hey, what do you think about this? Do we need to run in and grab stitches from you? What is this? I get a call. Hey, Melissa, tell me more about this. And I explain the situation. Okay, let's get a picture. Let's follow up in a little bit. Let's see when when the swelling goes down, when the bleeding kind of slows. And luckily, she didn't need stitches, but I also knew that if she did,
on it.
You're on it. You got it. You've got me. And the other thing that I love so much about you, Dr. John, as personally as a doctor, but also Voyage Direct Primary Care, is that you know my family. You know my kid. You know each of my kids. You know their names. You know their medical history. You will take an extra minute to be like, oh yeah, well, okay, I know this about Elle. So let's keep an eye on this. Or no, we better get her in just to make sure. And it has taken part of that mental load as a mother, which is so extreme and heavy at times. It has taken that. It's like I took that piece of my mental load and I just handed it to you, Dr. John. And I'm like, here, this is yours now. And I'm not going to worry about it. And that is the biggest relief. I would love to talk about my daughter Scarlett's journey with her autoimmune if we have a minute and if you want to get into that.
I do. First, I want to just highlight a couple of points to your story just now. And one is the scarcity-minded state of most Americans right now. They just don't go to the doctor. And there's many reasons for that. And they're not all on the insurance. Sometimes they're our fault too. So I would say insurance companies want people in that state of mind, a scarcity-minded state around care. I just don't go in. I'm scared to go in. I'm hesitant. I'm not sure. I don't want to feel like a dummy. They want all that stuff. They've created this convoluted system to serve their shareholders, and they're doing a really good job of doing that. From a care standpoint, we, the doctors, are guilty of providing crappy service. So your mom doesn't want to go to the doctor, probably because she's treated like a number. It's a quick visit. There's no connection. The doc probably, I don't know, they might know their name, might not. And so it's just a poor service offering. And so we are in a service industry where there's terrible customer service. I don't understand that, but it just is. So I think there is no such thing as a bad mother question. There's no such thing as that. So for years, we have tried to recalibrate all of these mamas to just help them be abundance minded. You know what? I'm just going to text my doc right now, right? Like, yes is the answer. And one of the things I did to help with this is whenever somebody reaches out, my first response, whether it's text or in person, I say, thanks for reaching out. And because it is nerve-wracking, doctors are just kind of pedestalized already, right? And they're like, oh my gosh, I don't know if I want to bug the doctor. He's probably busy. He's probably got this thing. And so I always probably pour water on that and just say, thanks for reaching out. How can I help you? And just that phrase is clutch. I love your story in sharing, like, my anxiety levels around healthcare are so much better now. I once managed a gal, it was like 7 a.m. She had a horrific kidney stone and didn't know what to do, right? She was doing the thing, Google in her basement, pretty sure I got a kidney stone. I'm not sure what to do. I got to go to the ER. If I go to the ER, it's like $1,200 for walking in the door, $2,400 if the doc looks at you. And so she was like, I'm not sure what to do. And she called me. She's like, oh yeah, wait a minute. We signed up with Voyage. Awesome. So she calls and I'm like, oh yeah, this is a kidney stone for sure. And I actually just went to her house because it was 7 a.m. and she was in a massive pain. And there's an easy shot that we can give folks for really bad kidney pain. And it really helped her symptoms. A lot of it is just managing that pain as she's passing the stone because it's horrible. And so we did that and then gave her some other stuff and she did great. And she mentioned, she says, Doc, you have fixed my interface with this broken healthcare system. We have insurance, but I got a copay, I got this thing, and it puts me in this hesitancy mode. And now I have no hesitation. It's just easy for me to just reach out, get an answer, probably a solution, and then move forward, That's awesome.
Absolutely. I feel just like this other patient of yours. And I feel, yes, you've taken that load from me. And at the same time, you have made it so, you are so approachable. I think that's obviously an awesome personality trait that you have, but at the same time, it's this system that you have leaned into with the direct primary care because it makes it possible, and you make everyone feel comfortable to the point of like, yeah, thanks for reaching out. Mm-hmm. This is okay. We're gonna work on this together. I care about you. And let's do this. And I'm grateful for that. So thank you.
A lot of it has to do with the way that we interface. So you just pay me a monthly membership, right? I don't need to bring you in to collect a copay, to collect from insurance. And so it changes the dynamic of what we can do together. And it's so magical. Like I'm so happy I can care for people in a way that doesn't like, oh, wait, I can't talk to you on the phone because I won't be able to collect a copay from this payer over here. You just an affordable amount per month for your family, and we can just get rid of all that stuff, and then I can over deliver. So often we do that, right? So folks will pay for this much care, for this much, for membership, and they get this much care, and I love that. I'm like, yes, abundance is good, and we want to over deliver for our clients. That's our goal. I want to close the loop on two things real quick.
Yeah.
So one is another rash that I just want to just circle back on, and then I want to listen to the story on Scarlet. So the other rash that needs to be brought to somebody's attention is hives. Hives can be very, very, many things can cause hives, and hives are never normal. And hives that then start to involve airway. So like, yeah, I got hives all over my body, and now I'm just having a hard time breathing, and I feel like a little swelling in my throat, and gosh, my lip is swelling on the inside a little bit. That's an ER visit. Skip everything. Go right to the ER. They got to get steroids on board, and they got to get epi and a whole bunch of things going just to keep you alive, because hives can sometimes invade like mucous membranes, and then you got closing of airway, and then you die. So that would be the other thing that I would be remiss if I didn't mention on the rash part. So hives are like, hey, not an emergency, but hives that involve airway, that needs to be brought to your doctor's attention right away. Mm-hmm. Okay.
Helpful. Awesome.
Story.
Oh, well, I'm gonna go back just a little bit. Mm-hmm. My cousin was sharing a story where she went to see her doctor about, I'm trying to remember what it was, one thing. And she ended up asking him another question because she was there. And she's like, oh,
By
at
the
the
way.
same time, by the way,
Yeah.
gets her bill and she's billed for coded for 3 totally different things. And she's like, oh, I didn't realize asking that one extra question was going to cost me $95 extra.
Yeah.
And so I love that that's not a game I ever have to play with you. I don't ever pay a copay. I don't ever have to like think that through and be like, oh, can I ask this other question?
Yeah.
Can I ask my doctor a medical question? So I really love that. So I had an experience last February where my daughter had a fever and we had just kind of nursed it for a few days. And she woke up in the middle of the night really hot. So I went to get her medication and realized that she was kind of looked like she was seizing a little bit, like in a seizure type of state and really stiff. And so that was my mama instinct was ER right now. So I get her in the car, race her to the ER, the ER. And we get her there, they hook her up. This was maybe 4 or 5 in the morning. Once they get her kind of stabilized and we're talking through things and I have a few minutes, I send you a text. Hey, Dr. John, just so you know, we're in the ER. This is what's going on. And what I loved is that through this process, she ended up having a disease diagnosis and we were, at least a couple of weeks in the hospital and transferred to primaries. But what I loved is that I was getting texts. This is like so unheard of. People that aren't with Voyage Direct Primary Care are going to be like, what? This happens? I was getting texts from you, Dr. John, asking not only how Scarlett was doing and what was going on, but also how I was doing and giving me ideas and tips for like calming myself down or taking a minute for myself. And on top of that, you visited the hospital a couple of times to check in on Scarlett and me. And just having that reassurance and that support meant the world to me. And I was also really impressed just in general with your medical knowledge of what was going on with her, because it was such a rare disease and like a very kind of interesting case that even the doctor at the hospital was like, at the first hospital we went to was kind of like, what? And you were like, okay, I think this is my, hypothesis of what's going on. And you were right on the money. You were right. You hit the nail on the head, which I was so grateful to have you have explained that to me, because the doctors in the hospital aren't going to give me their hypothesis because they don't want to scare me or get me going down a road. But you were so honest and direct and caring about it that it made a world of difference. And, everything worked out really beautifully, and my daughter is doing really well. She's, still living with this, but she's doing well and things went the best that they could. And I really attribute that to having you there along the way with us, kind of holding our hand and reassuring us and being there as Scarlett's doctor and advocate, not just as a random ER doc or whatever it was. So that is something that just really solidified, if it wasn't already, really solidified that this is our place forever. Like, this is where we will be, and I will tell all my friends. And it was so fun because after we had this experience, I've always been telling my friends, but there was one friend in particular who was like, kept almost making the jump. It was like, I don't know, I'm a little nervous because it's different than what everyone knows. Yeah. She made the jump and I get a text from her. Oh my goodness, I just met Dr. John. We are just so grateful. We've already asked him questions. This is the best change I've ever made. And that text, I was like, yes, someone else gets it. She gets it. And so that was really fun for me. And she and I are now set out to convert all of our friends to you, Dr. John, but direct primary care in general. And that's just kind of a personal story. But I have so many over the 4 years that we've been with you of just individual things that have happened that just have made such a difference in my life. So things from like the rashes that we talked about, the do I need stitches like we talked about, a broken arm that you met us in the office for after hours. Like, I think that's broken. Let's take a look at that. What else? Earaches. I don't know about earaches in my house are such a thing. They are happening all the time. So I'm like, okay. And you're like, okay, let's press here. Instead of making a busy mom come in to check every little thing, it's like, let's see if we need you to come in. Do we need? Yeah, we need you to come in. This is important. Yeah. Or I think we can watch that. And that has been so life-changing. I mean, I don't want to sound dramatic, but it really is, because our health is what we have, right? So
that is such a cool story. And you brought out some really important points that are hard for me to tell people that, they ask, well, what does Voyage Clinics do? And I'm like, well, family doc, we do a lot of things. But you brought out some points that aren't in a list of services that we offer, because they're just part of the relationship. They're part of the culture that we have. It's not like that's you do dermatology, you do pediatrics. This is more than that. And I'll tell you why. If you invest in a direct primary care clinic in your community, you're investing not only in your healthcare, right, of your family, but you're investing in a change of culture of healthcare in America. And that change of culture allows us to do what you delineated in your story. Like, I can go to the hospital, visit you, not get paid for it. I can give you a call after hours and come in on a weekend, and there's no transaction, there's no copay. For you or me, I don't care about that, right? It's gone. Now the core value between us is just good care. And how can I do that for you? And so advocacy in a broken healthcare system and being able to behave differently and deliver something different. I think you're investing in a real change. It has to be done this way, with people and doctors just engaging directly. It's a grassroots movement to fix healthcare, because we fix the culture of healthcare. If we allow for this current broken system to continue to be the way that we engage, you engage with me through your insurance company that sometimes pays me, sometimes doesn't allow me to call you, doesn't allow me to telehealth, or doesn't cover this, doesn't cover that, then that system, that relationship will continue to be fragmented and silly and create all these pain points. So I think that it's a little bit of money, yes, but it is an investment not only in your healthcare, but in the future of healthcare in America. We truly can recalibrate and redirect this whole ship, but we have to do it directly with people or small businesses and docs directly. And that story just shows so beautifully how that change can look for folks. It's hard for me to say, to say all of those pieces. I think it's so cool that how you said it, really cool. While you were speaking, I thought of two important pieces. So, fevers in a kiddo, how do I know when it's a big deal? And then fevers in a kid with a seizure. So febrile seizures are super common. They often are during the increase or the drop in the temperature. And so it can happen either way. And so a febrile seizure doesn't last very long. They have certain symptoms and usually they're totally going to be totally fine. Really scary for parents. Like, holy crap, what's going on? Scarlett's seizure was different. It was different. It was subtle, but it was different. And so I think initially the ER doc and myself were just thinking, febrile seizure, no big deal. But then ask a few more questions, right? Spend a little more time, get past that surface, and then say, nah, something else is going on here. Something else is going on. And then she continued to have different symptoms a few days later. And that's when we said, whoa, this is super not normal. We need to go. We need to do some more digging here. And so just those easy access points to help me to weigh back in on the equation. Well, I thought yesterday would totally change today based on a change of symptoms. And so being able to have a low bar for reaching back out and saying, hey, doc, still not better. This is how it's progressed. Is that normal? Like, no, that's not normal. You need to get back to the hospital. We need to get these things further investigated right now. So I think that's really, really important. And it's lost in today's system. Like, oh, you want to follow back up with Dr. John? Sorry, you can't reach him. There's 3 layers deep and you still can't reach him. And you have to be scheduled 3 or 4 or 5 weeks out, that kind of thing. And so, it's just neat. And then the other thing that you mentioned was, fevers. When is a fever a big deal? I think anything above like 102, 103 into that space, bring a fever to your doc's attention, right? Bring it to their attention. And then if it's around certain symptomatology, like, again, it's not mama's job to try to be a doctor. It's just your job to say, spidey sensors are tingling a little bit. Let me call my doc and just have a discussion about this. And if reassurance is it, then great. Awesome. And often, because my mamas can reach out so quickly, they're reaching out within 2-3 hours of sickness. And sometimes the answer is, well, let me just see how this goes tomorrow and call me back and let me know. And so instead of, it's just really early in the ball game sometimes. But if it's a really, really high fever, 103, 104, you can't bring it down with Tylenol, ibuprofen. Those are big deals. Those are big deal things. Other symptoms around fevers, you want to bring those things to a doc's attention. Those are really important too.
Yeah. Yeah. And that was kind of where we were at. We were in the 104 and I was like, we can kind of start getting it down, but we can't get it very far down. So I was really grateful that, we got her in and we had kind of this follow up along the way that it was like, okay, here's our kind of our starting point. Where are we now and where are we going? And that was extremely helpful. I remember when my oldest, it was my second daughter, was 2. And she climbed up on a couch and kind of like somehow got her legs kind of taken out from under her and she fell on tile on her head. And I heard it. I turned and kind of saw the after and I was like, oh, this is bad. But being with the traditional health insurance and, not having a doctor that I had a super close relationship, we did have a pediatrician. I called the pediatrician's office and said, hey, like this seems pretty intense. And they said, okay, let's transfer you to the medical assistant. I finally get to the medical assistant. She's like, yeah, you can leave a message with me. I'll talk to the doctor. She calls me back a few hours later and said, the doctor said it looks like you have an appointment coming up in 2 weeks. So we'll just see her then and we'll evaluate, but it should be fine. I get there in 2 weeks and the doctor says, what is going on with her head? Like, this looks terrible. What's happening? Why didn't you bring her in? And I was like, I called. And he's like, oh, what happened? And I told him the story and he said, wow, that should not have happened. You should have brought her either straight into me or into Instacare. Like, this is intense. Yeah. And I felt like moms do, guilty and terrible when
like it's your fault. Like
it's my fault.
Yeah.
And some of the lasting effects from that I felt so terrible about. And now looking back, I can take a step back and say, that was part of a broken system.
Totally.
That was not just mama fail.
Yep, for sure. Earaches. So lots of earaches, and there's lots of different kinds. And I just want to briefly go over those with you. So they're little kids, small kids. Their eustachian tube and the ear canal, the angle is really straight. And as the face bones grow and the skull bones grow, it changes the angle. So ear infections, bacterial ear infections on kids are super common because it's so straight, because mucus goes straight from the nose, eustachian tube, into the ear. And then as we age, it's less common. There's 3 different organisms that are typical bacterial organisms for ear infections. However, it's not all bacterial. So 80% of ear infections in the first 7 days of viral illness, they're just viral. So a virus, think about it. The virus produces tons of mucus, and you've got a direct pathway right to the eardrum. And the kid's sleeping, and moving from side to side, and then the mucus pulls on this side, and they sleep this. The mucus pulls on this side, and that pulling of that mucus creates pressure on there, and it hurts. It's painful. So I always talk to these mamas and say, hey, this kid's got a viral illness, right? It's 3 days in and he's pulling on his ear. And I promise it's viral. It is viral. In Europe, they don't even treat ear infections. Like in America, we always treat with antibiotics. And that's why, because 80% of them or more are just viral ear infections. So let's now say, well, when is it bacterial? Like when we need to think about that, usually more than 8, 9, 10 days into a viral illness. So if you think about it, viral illness, lots of mucus, it's pulling into our ear canal behind the tympanic membrane, right? Behind it. And it's setting up a nice little stagnant pond, right? A petri dish, if you will, and it's growing some bacteria. Okay, now we're 10 days in, my kid's spiking fevers again, pulling at her ear. That's probably bacteria at that point. So I'll pop in and I'll look in their ear, and yes, it's bulging and it looks pussy. Then yeah, we need to treat that for sure, especially if it's 9, 10, 11 days after a viral illness. So it's really duration on that space. Other ear issues, really common, swimmer's ear, cerumen impaction. Yesterday I had one of each actually. And so cerumen is like the earwax that's in the external ear canal. So tympanic membrane's here, your ear's out here, and this is the external auditory canal. This is the internal auditory canal behind it. So ear infection, acute otitis media is on the inside media side of the ear, and it's the mucus thing with the bacteria growth. On the outside is the swimmer's ear, or acute otitis externa is the medical term for it. But it's pretty common, and especially if you have some cerumen in there, some earwax. If you think of a canal like this, half of it's full of wax, water or something gets back in there, and then again it creates a stagnant pond because it can't all get out of the ear because there's some wax there, and then it creates a stagnant pond, can grow bacteria, and commonly it can grow Pseudomonas, which is a bacteria, or actually like a fungus. And so we usually clean out the wax and then look in there and say, oh yeah. And externa, swimmer's ears, often has some discharge. They're like, oh, kind of gooping out some stuff, and it's painful to the touch. So you move the ear like this and it hurts, then it's probably swimmer's ear or otitis externa. And those ones are just treated with some drops, super easy. And yeah, that's no big deal. But those are the common earache problems. In adults, they'll often get a cold, and then you get to where like, it sounds like I'm underwater, and it can kind of hurt a little bit, but super uncommon for that to grow bacteria, because we don't get those as much as the kids do.
Okay, so we've got swimmer's ear that'll kind of be more painful, like when you're touching it.
Mm-hmm. And have discharge.
Viral, that's most likely associated with a common cold of some sort.
Mm-hmm. And like within 5 or 7 days of a cold.
Okay, and then if it's been more than 5 or 7 days and it's really painful still, kind of inside, like feeling like it's inside, not like to the touch hot out here, then that might be when you need antibiotics. But that's less common.
You got it.
Okay, yeah. I do have it.
Ear
awesome,
stuff.
Thank you.
There's your ear stuff. Yeah.
Yeah, I love that. That's really helpful.
Mm-hmm.
Cool.
So yeah, those are the main points with the ear. And so we went over rashes today, went over kind of fevers, we went over some ear stuff. I think we have a lot more to talk about. So but we're out of time today. But let's circle back and let's keep answering questions. I think there's a whole bunch more questions about adolescents and like older kiddos and all kinds of really great things. So let's do it again. Is
Sounds
that okay?
Great. Oh, absolutely. I'd love to. Thanks so much, Dr. John.
Melissa, thank you for sharing your story. I love your personal journey. I love how vulnerable you were today. Thank you. I know that's tough. And thanks for sharing your experiences with Voyage Clinics and how your healthcare equation has changed. I think that's wonderful. So many people have health shares or high deductible plans, and they're like, oh, I'm not sure, what to do with this. How do I engage? And Voyage Clinics is a little bit of an add-on, but boy, does it relieve a ton of those pain points. And the other perk that we didn't really mention was getting things figured out here is very, very affordable. So with health shares, like, you're paying cash for a lot of things. And so we have our labs are super, super, super cheap, like 1/10 the cost of cash price labs anywhere, and insurance charges even more. And so often, even with insurance or a health share, they're still saving money just running it through our clinic to gain access to those labs or the imaging, MRIs, pathology. There's tons of things that we do that's even cheaper than insurance. So it's just really fun to try to re-script healthcare, try to fix it, and do it in a beautiful, affordable, transparent way. That's our whole mission.
You're doing a wonderful job at that. Thank you so much, Dr. John. I really appreciate it.
Thank you, Melissa. Thanks for your time. To our guests, thank you. I hope you learned some cool stuff today. We will be back. I think Melissa is awesome and she has lots more questions, and I'm sure many of you do as well. Please, in the comments, just put down some of your mama questions. That'd be super helpful. And like and subscribe. Thanks.